Welcome friends to the healthcare today. So what is Fibroscan? It's a magical instrument as of now. We know that Fibroscan that it is used for fatty liver. We also get to know about fatty liver from ultrasound, from liver function test. But do you know this test does not actually help you in knowing the fibrosis. It does not help you to know your damage or scarring of the liver. The Fibroscan test is actually revolutionary in today's world. So what is Fibroscan today we will be understanding. How is it important and why you are neglecting Fibroscan test. Although we know that Fibroscan test is not so much available, but it's tier 1, tier 2 cities and it's almost 2-3 years we can see the transient elastography can be done in all diagnostic centers. Fibroscan is a test which actually helps you to understand if you are having fatty liver or you are having fibrosis. So we know that ultrasound helps to know that you are having fatty liver, as already told in the previous episodes, that the conditions where you actually can get to know that you are having fatty liver damage or fatty liver disease. So Fibroscan helps just not only is a tool to understand that there is a fatty liver, but also actually helps you to understand how much damage is there. So as the name suggests, Fibroscan means fibrosis and scanning. Means this instrument, this test is used to scan how much damage is there in your liver in the form of fibrosis. In today's world, we actually are very much lenient about our health and we just neglect ourselves that we just have fatty liver and each and every individual is having fatty liver. The liver enzymes may be having 50-60 are so much neglected toward today's world. But this is a very sweet poison. This is killing your liver, this is killing your age and it's increasing day by day. Ultrasound just helps you to know what is fatty liver, that you are having fatty liver. Liver function test only shows that you are having liver inflammation, that NASH, non-alcoholic steatohepatitis. But does it suggest that there is fibrosis, there is damage, permanent damage in there? No, not at all. Ultrasound just helps you that your liver is inflamed, your liver may be having fatty liver, your liver function test, the blood test is only helping that there is inflammation. But you cannot say that you are having fibrosis. You cannot say that you are having scarring. You cannot say that you are having permanent liver damage. Yes, so Fibroscan test is a very simple and very easy process test to do to understand how much fibrosis is there. Almost 10 years back, we used to do this liver biopsy to understand if there is permanent damage in your liver. Now it is not used. The liver biopsy is used in only very specific conditions and in conditions where it's required and where 2-3 things are there where we have to understand what liver biopsy is required. Fibroscan actually helps in 95% of the conditions. It is a very simple procedure. It is a very simple test. It is a small portable machine, a type of ultrasound. It has the probe and that probe is kept over the liver on the right side. Because the liver is on the right side, we keep the probe on the right side, the lower chest. The only prerequisite thing is that you have to have 4 hours of empty stomach. That's all. This probe is kept over the right side of the chest and the lower chest. It is usually done by the technician. It usually can be done by a doctor as well. Simultaneously, as soon as you keep the probe over here, we get to know the results. So we take multiple estimations, we take multiple measurements to understand the liver fibrosis. Where is it? Within 30 seconds to 1 minute, the scan is complete. And in the screen, we actually know how much quantification of fibrosis you are having, how much of fatty liver is there in your liver. So there are 2 things to understand. One is the fatty liver and other is the fibrosis. Both the things are being available in the screen simultaneously as soon as we complete the procedure in 30 seconds to 1 minute. It is such a simple procedure, no invasive, nothing, no pain, nothing. It is just an ultrasound. It's just an ultrasound. So as soon as this test comes, we just get to know in exact values how much fat is there in the liver and how much fibrosis is there in the liver. So as important thing is the fibrosis, To know if you are having a fibrosis scan of less than 5 or equal to 5, it's a normal thing. I'm just making it a very simple thing. If it is between 5 to 10, it means the early stage fibrosis there, or F1 fibrosis. If it is between 10 to 15, it is second stage or F2 stage. If it is between 15 to 20, it is F3 stage. And if it is more than 20, F4 stage fibrosis, that is cirrhosis. That means the liver is damaged completely. There is a lot of fibrosis, there is a lot of scarring in there. This test is actually helping you in getting the fibrosis. Ultrasound can never say how much F1, F2, F3 or F4 fibrosis you are having. It can only suggest when your liver is completely damaged or the patient is having only just a fatty liver. Between the F1, F2, F3 stage, the ultrasound usually cannot give a guarantee that you are having liver damage. They will only suggest it's a fatty liver. It only suggests increased oncogenicity, but it cannot say that there is fibrosis in your liver. That is a very important takeaway today's episode. Second, the liver function test can only suggest there is inflammation in the liver. Even in condition of F1, F2, F3, we have seen patients, the liver enzymes are completely normal and there is a lot of inflammation. And we do a Fibroscan test and we get to know that the patient is under second stage, third and fourth stage, maybe cirrhosis. So it is very important, do not rely on the LFT's report, do not rely on your ultrasound reports. Just take these two tests, LFTs and ultrasound, as a screening test that you have a fatty liver disease. You are having fatty liver. But to know that you are having this scarring or fibrosis, you have to have your fibrosis scan done. That is a Fibroscan test done. This Fibroscan test done can be done easily available in the clinics, hospitals and diagnostic centers as well. It's just a double cost of the ultrasound report, and probably we do not recommend any ultrasound report. If there is some patient we have clinically symptoms of fatty liver, we just do a Fibroscan test and that actually helps us. Save patients, we save money, a lot of money, not in getting. I'm not against the ultrasound report, I'm not against any liver function test, but I'm telling you what is the importance of Fibroscan test done in today's world. Recently we came across a patient who was almost following 2-3 years. His father died of cirrhosis with a genetic history and he was very much concerned about his fatty liver. He was obese and he was also having a lot of other comorbidity conditions. He was doing his ultrasound report done for the last 2-3 years, and with a good corporate hospital, he was being reassured that you are having just a fatty liver, not anything else. He came to me with a loss of appetite. He came to me with a lot of fatigue and easy stress, dizziness and all those things. We get a Fibroscan test and then it was showing a fibrosis scan of 33. That means he was already having a cirrhotic stage. He was too much amused regarding this test and he was actually even saddened regarding the truth of other tests. So that is an important thing. If had this patient, if this test has been done before, we could actually early assessment of this patient of fibrosis or liver damage, and we can actually prevent that progression. So if you are a patient, if you are a normal individual but having all those comorbid conditions, type 2 diabetes, hypertension, cholesterol, PCOD, heart disease, obesity, lot of junk food, sedentary lifestyle, hyperpigmentation on the neck, or there may be hyperpigmentation on knuckles, then definitely go for a Fibroscan test done for yourself to know that you are having liver damage or not. Because fibrosis decreases age. Fatty liver usually does not cause a lot of problems, but fibrosis has an impact of how much you survive. Get this test done. Be very sure about how much damage is there. Is there actually a damage or not? It's just a fatty liver, or there is associated damage in the liver or not. These tests are very simple and easily available. Thank you.